Hello, nurses. I hope you all are doing very well. So, today let's talk about the key points of Parkinson's disease or PD. Parkinson's disease is a disease of the central nervous system which mainly affects the movement of the patient, and it is also known as the paralytic agitance. Paralytic means palsy and agitance means to shake. That is the shaking palsy. It is also known as the shaking palsy, the tremors. Okay, so this disease occurs due to the dopamine deficiency. Dopamine is the chemical messenger or the neurotransmitter which helps the nerve cells to communicate with each other, and there are dopamine receptors present in the basal ganglia, and in the Parkinson's disease there is destruction or the damage of the dopamine receptors which are present in the basal ganglia, so there is problem in the coordination of the patient. Okay, so what are the causes? So firstly, advanced age, the age, if the patient's age is more than 50 years, then degeneration of basal ganglia as I discussed, then due to the viral infection, and some of the antipsychotic drugs like typical antipsychotic drugs like haloperidol, chloropromazine, atypical antipsychotic drugs like olanzapine, quetiapine, risperidone. Okay, so these also can cause Parkinson's disease, like genetic factors which plays a rare role in case of Parkinson's disease. Then there are some environmental triggers, like if the patient is exposed to pesticides or herbicides, these types of toxins can increase the risk of the Parkinson's disease. The other risk factors are the low level of vitamin B and head trauma. Now, what is Parkinsonism plus syndrome? These are the symptoms which mimic the PD to some extent, but actually the symptoms are caused by the other neurodegenerative disorders. What are the clinical manifestations of the PD? So firstly, tremors, rigidity and bradykinesia. These three are the main clinical features. Here the tremors are the type of pill rolling tremors which is the earliest sign of PD, and rigidity is the type of cogwheel rigidity. Cogwheel means jerky and ratchet like movement, jerky and ratchet like resistance to the passive movement of the muscles. So this is the cogwheel rigidity. And then bradykinesia. Bradykinesia means slowing down of the muscle movement. Okay, like the patient have difficulty to do the simple task also, like eating, walking, etc. So firstly, hypokinesia occurs, then bradykinesia, and lastly akinesia, that is the losing of all the types of body movement. Then another important clinical manifestation is the shuffling gait, where the postural disturbance like propulsion and retropulsion occurs. Then micrographia. Micrographia means handwriting becomes smaller, then drooling of the saliva, urinary incontinence, constipation, pan face or a blank face. There is a blank stare of the patient. Then sleeping disturbances, like the patient awakes very early, or she or he is having nightmares. Okay, the mood disorders, like sometimes the patient feels anxious, sometimes apathy. Okay, then difficulty in speaking and hypophonia. Hypophonia means soft speech. There is a monotonous voice of the patient. The voice box becomes spasm. So these all are the clinical manifestations of PD. Then how to diagnose? Firstly, history collection and the physical examination must. Then CT scan and MRI. Then electroencephalogram and the positron emission tomography scan or the PET scan. Comes to the treatment, so in PD there are different types of treatment which are accumulated and coordinated in a manner. So here I have listed the main treatments. Firstly, anti-Parkinsonism agent which helps to increase the dopamine level of the brain. So here we use a combination of levodopa and carbidopa which have a synergistic effect. Basically levodopa converts to dopamine in the brain, but before it reaches to that area it breaks down. So carbidopa prevents the levodopa from being broken down before it reaches to the brain. So we use carbidopa along with levodopa. PD can occur by viral infection, so here we use antiviral agent like amantadine. Then GABA analog, which are the major inhibitory neurotransmitter. An example is the baclofen. Okay. Then the dopamine receptor agonist. Here are two types, like ergot derived and the non-ergot derived. An example of ergot derived is the bromocriptone, and for non-ergot derived we use pramipexole drug. Now let's come to the nursing care. So firstly, obtain the history and all the sign symptoms, the feeding pattern, mobility, communication of the patient. Then by performing the neurological examination, assess the cranial nerves, the cerebellar function and the motor function of the patient. Then observe the gait and the performance of the activities, and also assess for the clarity of the speech of the patient. Okay. Then check for the signs of depression. As this disease mainly occur in the old age patient, so there is a major chance of the patient is becoming more and more depressive. So provide psychological support as needed, and also provide the safety measures of the patient. Also provide the prescribed medication on time, and plan for the nutritious diet, the range of motion activities, physical therapies, occupational therapy, speech therapies of the patient, and manage all the complications of the patient, like a potential complication of fall, dysphagia, cognitive changes, etc. Schedule for the follow-up appointments for the patient, and also coordinate with the other healthcare professional to adjust the treatment plan and to check for the disease progress. I hope it helps you a little, so thank you so much.